All right. Hello, everybody. Welcome to Evolve Year's new podcast series, Mental Health. It's more than just a buzzword, where our goals are to highlight students working in creative ways to improve student mental health and to share ways that you can prioritize your mental health. I'm your host, Avion Howard, a recent psychology grad and self-improvement content creator. You can check me out on Instagram at deluxe_evolution, where I talk about topics like life purpose, motivation, self-worth, and many others. And I'm here with our special guest, Melanie Yu, a college student and Toronto youth advocate. It's great to meet you, Melanie. How have you been lately?
I've been doing good.
That's all good. That's all good. So I do want to start off the conversation with your program that you're a part of that helps Toronto youth. So could you, tell me a little bit about that, the Toronto Youth Cabinet and how you got started with them?
Yeah, for sure. So, as mentioned, my name is Melanie, and Toronto Youth Cabinet is the official youth advocacy body for the city government. And I actually joined them when I was around like in the latter part of high school because back then I was highly interested in politics and I really wanted to make a difference within my community. And I found out about Toronto Youth Cabinet through a lot of my socials and through my peers who were previously a part of it. And the reason why Toronto Youth Cabinet is just such an interesting organization, but also just, it really gives you an opportunity to connect with youth who are very like-minded. As mentioned, like what makes it so amazing is that it really involves in civic engagement, and you really try to understand and uplift a lot of voices that might not be able to be traditionally heard within a government environment.
Interesting. Okay. So, working with that organization, what is it exactly that you do there?
Yeah, so it's a very long journey actually, but when I was in late in high school, I just joined as a working group member. So essentially, how Toronto Youth Cabinet is divided up is that they have multiple working groups which are centered around different aspects of Toronto. So for example, there's urban health, there is arts and culture, there's environment, etc., etc. So then I joined initially just as a member of the urban health working group. And then a few years later, I became the urban health lead. And then now I'm actually the director of organizational development. So I've been there quite a while.
Yeah, I can see. And I noticed that you do mention urban health thing that's your division. So what does that mean to you to advocate for urban health?
Honestly, it's such a complex topic. It's something in which I've definitely had a lot to think about because you would think that, the words urban health, they might seem obvious, but at the same time, it's really not because basically any health issue that is revolved around a city environment is categorized under urban health. So it's both a bit of a confusing journey, but also a bit of an honor as well, because what urban health really does is that, in my opinion at least, it intersects with so many sectors of city life. For example, how does the environment impact cities and subsequently youth health? How does housing perhaps affect the city and then youth health as well? So in general, I think that urban health is just an incredibly broad category, if I'm being honest. But at the same time, though, it gives you that opportunity to really explore and understand how multifaceted health is. Because in general, as I mentioned, when you think about urban health, it just covers so much. And honestly, I would argue almost anything can go into urban health because a lot of things really go back to it.
I think you're majoring in what, nutritional sciences and global health, correct?
Yep, exactly.
Okay, so yeah, I wanted to ask, how do you think that ties into what you're doing here? How does that contribute to advocating for health? How does that impact health in your community?
Yeah, for sure. Honestly, when I first started out, how do you say it? Like, I knew that I wanted to do something a little bit health related, but at the time, I didn't exactly know which two majors that I wanted to go through. So originally, I decided I was like, I want to do global health because the urban health working group really gave me a good perspective as to how health works within cities, but then I wanted to be able to kind of expand that onto a global lens, which is why I was curious because in some ways I guess you could say city health contributes to global health, but global health also contributes to city health. So I think that gave me that really cool opportunity to understand how these two bridge together. And then nutrition is highly, highly, highly correlated with global health as well, because as we know, nutrition is one of the most, or arguably the most important determinant of health in our entire society, talking about how to eat healthy, whether it be for your physical health or mental health. So both of those two ways really tied into my passion of urban health. And it just really allowed me to have, I guess you could say, a more macro lens, but then also a focused lens as well when considering the context of our city.
Yeah, and that also reminds me of that connection between physical health and mental health. And I wanted to get your perspective on that connection as well. So how do you think one impacts the other?
Honestly, I would say that they're both incredibly intertwined. Um, Mental health and physical health, obviously they both have health in it. That's
Yeah.
that's one of the parts which, like, I think that's what seems obvious to people on the surface, but at the same time though, we need to really unwrap that as well, because I think that if we look at a lot of chronic conditions, especially, they really have to do with mental health. For example, as we know, a lot of conditions, for example, like neuropathic pain, which persists across people's lives where they have to deal with it for decades, a lot of people who are afflicted with it tend to have higher rates of suicide, depression, anxiety, and etc. So often we see that when it comes to a lot of health conditions within lives, they are highly interconnected with each other, and one will ultimately impact the other, which is why it's really important to take care of health overall.
Yeah, I totally agree with that. And what do you think are some, let's say, ways that you think people could improve their health, both, physical and mental health?
Hmm, I don't know, but at the same time, I do know in the sense where, you know, there's ones in which we always give, for example, exercising. Exercising has been proven to always be healthy, whether it be a mental way to relax, but then also, in ways in which, well, you're just working out, and working out is always a pro for your body. But at the same time, though, I think that when it comes to physical health and mental health, it also is something in which it's a bit of a self journey as well. Because as mentioned, for some people, it's more so about nutrition rather than exercising. I know I'm definitely one of those people. I cannot do exercising for the life of me. So, I'm definitely that person where I'm like, I would rather just eat healthy, because eating healthy helps me to, be healthy. But then on top of that, it also helps with mental health as well. So ultimately, I think that, I don't really want to give too broad of perspectives, because I do think that people need to be able to kind of explore their own options and then find what works best for them.
Yeah, actually, I love that answer too, because it is important that you have to balance out, like you said, the different types of things and different things that you're doing, like not just focusing too much on, you know, improving your mental, or not just too much improving your physical. Both have to be on that same level within you to reach, um, good overall health. But I also wanted to ask too, because you talked about balancing and everything. So, how do you balance your mental health when you're working on topics such as these?
Ooh, you know, it's hard because definitely as a full-time university student, but then balancing as extracurriculars, things can get tough sometimes, particularly my schedule. It can be very difficult to find out times in which I can also just, go out with my friends, have fun, and not really feel too burdened by everything that is going on. Honestly, um, I think for me, what's been really helpful is a principle called mindfulness. And a really important thing about mindfulness is that you focus on being in the present rather than thinking about the past or dreading things in the future. And by being able to center yourself into the moment, it also really helps you to appreciate the little things that are every day rather than only thinking about what's coming up next or what you regret in the past. So I think for me personally, having that mind frame really helped me to just have a better outlook on life in general. So I think for me, that's what worked. But as I said, it could be something else for someone else.
Yeah, I get that totally. I get that totally. And that's like one of the big principles that we have here at Evolve Your Health too, is about mindfulness, staying in the present, making sure that you're in the right mind, you're in the right mental state, That way you can live an effective life and you can live the most fulfilling life that you can. The present time is really the only time where you can live in. Your mind can be in the past and your mind can be in the future, but ultimately you can only act now. You can only change your life right now in this very moment. And I'm glad that you touched on that aspect of mindfulness because that is a very important lesson. And speaking of values and life lessons, what are some other valuable things that you've learned when working with the youth cabinet?
Wow, okay. Hard-hitting question. Hmm. I maybe something that's a little depressing in some ways. I don't know, but I think something which I learned on the youth cabinet, which really was both inspirational but also realistic, is that it's important to be able to set up goals, long-term ultimate goals that the youth cabinet we are really striving to see because you want to make differences in the city, but then also understanding that it takes time and it takes sometimes many different people in that one role of like urban health lead or director of organizational development to see that ultimate goal come into fruition. But at the same time, though, even perhaps maybe you weren't the one who was right there in that position when something does pass through. That's all right, because as long as you're able to put a step forward for the next generation, then sometimes that's all that matters. That's all that's okay with. And I think sometimes, especially nowadays, we have this idea in which it's like, you have to be the one to, do all these big goals, fulfill all these big accomplishments. But the reality is that a lot of the times it takes generations, it takes time, it takes so long. And even though it can be really frustrating for you to have those ideals and for them to maybe not be fulfilled during your time, you still also, I think, just need to be proud of the stuff that you have done. And as long as you're all advancing into the right direction and or into what you think is the right direction, then that's all that matters.
I love that. It's very impactful. I love how you have the focus on like paving the way for the next line of people that come in instead of focusing on like trying to accomplish everything and be the most successful, finish everything right here and now. Because it's true what you talked about. Sometimes you can, sometimes you can't, but it's more effective to, you know, set the tone and pave the way for the next generation of people to come in and take your place and do an even better job than you did before because you're giving them the tools for them to advance and them to create a new line for the next people that come after them. I love that a lot. That's very impactful. And I want to talk a little bit about social media because you're working with youth in Toronto. Pretty sure that's a prevalent topic that comes up too. So, how do you think the rising use of social media impacts those urban communities that you're working with?
Mm, it's such a mix, I think. In some like social media is so complex because, I do think that there is unfortunately a lot of negative impacts about it because I think that social media has, yes, it has bridged us together, but I think it has also given a lot of people access to certain lives in which you can feel envious of, in which you're like, I want that life so badly, even though, let's be honest, we're not all going to be Elon Musks in this life, billionaires, and I think in some ways it creates this sadness and rightful envy sometimes, especially, like if we're looking at billionaires, I'm just saying, but regardless though, um, I think that in that way, unfortunately, we're seeing a lot of like negative aspects of social media because it does breed a lot of negative emotions. But at the same time, though, you can argue, as I said, that social media does help to tie and bridge a lot of communities together across the entire globe. For example, one of my current best friends right now, she lives in Britain, and I'm so honored and glad that I'm able to meet her and to really understand her life and her perspective as somebody who is in the UK. So as I said, many downsides, many upsides, but do you maybe have anything you want me to focus on or talk a bit more about?
Um, We could focus on upsides. Like, how do you think social media can promote strong mental health?
Hmm. Well, for one thing, I think that something which does need work, although it is drastically improving, in my opinion, is mental health resources becoming more accessible since it is online. As somebody who also works as a crisis responder for Kids Help Phone, it's amazing that we're able to have these hotlines that are available 24/7 for youth to access when needed. And they can do it just by texting, because I think that something which we don't appreciate sometimes is that calling in and having to talk to somebody is very, very daunting. And I think that being able to give that option for people to text, to sit on what they want to say, rather than having to just, sometimes when you speak it out loud, it can just be so much more intimidating to talk about your feelings and having to give a voice to it. But instead, you're able to just type it down, which is more suitable for other people. I think that's where, online social media and in general has been really helpful with. In addition to that, obviously with social media, helps to amplify a lot of these resources. It helps to bridge and connect people to a lot of these resources again. As mentioned, I think that just trying to recall from the top of my head, Kids Help Phone is so well known right now as a result of a lot of social media campaigns, of a lot of advertisements, as a lot of schools sharing this resource to their like school kids via like websites and stuff like that. So in terms of the online space, I do think that in those two primary ways, we are seeing that it's really helping with mental health.
Yeah, and I think that's actually one of the main issues involving people getting assistance for the mental health is the accessibility factor. That's what Evolve Here is all about, is making this type of content, this type of engagement that we're doing right now could be beneficial to people that are watching it. And just small examples like that are what Evolve Here is all about. That's why I love this organization so much, because it's, providing resources that people do need out there. That's also, why I
Exactly.
create content in the same realm of mental.
For sure. And it's also really good too, because as we can see, we can also tailor the resources as well in order to ensure that they're meeting that audience's needs,
Yeah.
because I do find that sometimes, when it comes from larger organizations, then it can sometimes be a bit too general. But what's nice when you have like smaller organizations like this is that they're able to tailor said resources more. So people are able to kind of find what they actually need rather than having to scroll through like 20 pages and try
Yeah.
to find what applies to them.
Yeah. I think that's also what can make social media a little daunting too, is having so many options to go to and like choosing what influencer, what kind of thing you want to follow. So I remember toward the beginning of the conversation you talked about getting into politics. I wanted to ask you a little bit about that. What policy changes do you believe would be necessary to improve mental health outcomes for youth in Toronto? Like, what kind of policy changes would you like to see added?
For sure. For me personally, I think that the biggest one, which to be honest, I think it's applicable outside of Toronto even, is that I think that we do not have a very good transition of our mental health resources for youth into adulthood. Often what we see is that we have almost put youth mental health resources and adult mental health resources into like two separate circles. So what happens is that we have unfortunately a lot of people who are engaged in mental health resources as young people, but then because, perhaps they're going through something in their lives or they don't understand how they can connect to the next level of mental health resources, they end up being lost along the way. So unfortunately, I think that Canada as a whole really needs to find a way in which we can smoothly transition youth into adults when it comes to their mental health resources. So we're able to ensure that they are constantly protected and they're getting those resources that they need. Another thing that I want to also be like changed as well, as I could say, or maybe not changed, but improved upon, is I think that the current Canadian healthcare system is quite fragmented in many ways, where, as we know, there's that process of going to a family physician. The family physician has to recommend you to the right people, and then you go to the right people, and then they might recommend you to another person. And this fragmentation is so incredibly daunting for people who are going through struggles with their mental health. And often, even just me personally, as somebody who has seeked out mental health resources before, it can be really discouraging. You're tired of filling out all these different applications and having to go through all these different meetings with 2 million professionals. So I think ultimately, if we're able to provide a more cohesive system in which people are able to just, limit the number of applications they have to see, or the number of professionals that they constantly have to meet again and again, then this can really help to ensure that people do get the help that they need.
Interesting. Yeah, the first one you pointed out is I never even thought about it like that. So it's really enlightening that you talked about that. The separation between different aspects of mental health when it comes to youth and older adults. I never thought about that. And the second one about the healthcare system is actually similar to how it is in the United States. Have you ever been to the United States?
I was actually born there, but I didn't stay there for
Oh,
long.
okay.
So admittedly, I'm not the most informed about it, but at the same time though, I know little bits here and there.
Well, yeah, the health system that you describe is actually similar to the United States too, where it's fragmented. You're like recommended by that family physician, and you go to a bunch of different professionals until you finally get to the one that actually can help solve your problem. So yeah, that's interesting to
Exactly.
see. Well, I
Yeah.
also wanted to ask, because I'm sure you've done some research into like other communities and how they handle their health issues too. I wanted to ask about that, like from that work in global health. Um, how have you seen other communities besides Toronto handling their health, physical health, mental health issues? And what do you think Toronto could learn from those communities?
I think that this is such a difficult topic to speak to, in the sense where I think that Toronto as a whole, in terms of their healthcare or mental health care system that they have in place right now, can have many improvements. But I also think that there's a lot of grassroots initiatives which are really trying their best to get more funding and to get more attention. That are doing a lot of incredible work on the ground level. So not gonna lie, maybe a bit of a cheat in your answer because you're talking about communities outside of
Yeah.
Toronto, but I kind of wanted to highlight some communities which are in Toronto, but they're a little smaller and they have a bit of a different approach. But I think that they are really doing good work. So a good example is, I think that when it comes to a lot of smaller organized mental health oriented organizations that I've worked with in the past. For example, Mental Health Matters, Youth Speak, Empower Too. All of these are organizations in which, for example, they might have a very big focus on particular communities where often they experience inequities in mental health care. So, for example, those from marginalized backgrounds. And I think a lot of them, what they do, which I really, really like, is that they focus on community. They really focus on trying to get youth who are like each other to come into groups, because a very big struggle that we often have when it comes to youth is that they might feel very intimidated approaching adults, right, who are the professionals. So by creating these more smaller youth groups who are able, if we give them the skills, obviously, to support each other and to also understand when perhaps they need to go to an adult, I think this was a really, really amazing initiative because it allows these youth to firstly, make friends, feel a little less lonely in this world, but then also be able to understand that there's people who are going through similar things as them, who are also, as I said, from similar backgrounds as well. And ultimately, I think that's something in which a lot of youth nowadays need, and
Yeah.
especially as you mentioned with the rise of social media, that's what's really causing, I think, a lot of more disconnect in some ways, because you don't get those same face-to-face interactions versus these smaller grassroots mental health organizations who are allowing these girls, boys, etc., and everybody from all types of backgrounds to actually meet together in these small groups, have those face-to-face interactions, and really build true connections.
Yeah, I agree. It's definitely harder to build that sense of community in online platforms. It's not impossible. You could still do it, but it is different when you're having a group of people sitting with them, talking with them, versus texting each other back and forth in a chat room or talking across video call. But yeah, that's good. I'm glad that you were able to touch on that. And also wanted to ask about what other kind of issues do you notice among Toronto youth that's impacting their mental health besides the separation aspect?
I think that an issue that is becoming more prevalent is well, how do you say it? It's poor coping mechanisms, in my opinion. I think that a lot of the times youth, we don't give them actually a lot of skills for them to go through life with more confidence, you know? As somebody who grew up in Toronto, and then went to university where I faced a lot more challenges and a lot more difficulties in life, I felt so unprepared for it. I did not know how to deal with these negative emotions. I did not know how to deal with feeling overwhelmed at times. And it's something which I look back to and I'm like, okay, well, in high school, sure, maybe I learned what are symptoms of depression, but I never really learned about how I can, be able to maybe go to the right resources or alternatively cope with these feelings and how I can make myself feel better even if I'm having these symptoms. So I think that, this has really funneled into a lot of other things. For example, the increase in vaping that we're seeing across the city as well. I think that a lot of people, since we don't really teach them the right coping tactics, instead we use other things as crutches instead. So I think in general, that is something which I wish we could see that there's more change to really address this within the school systems, because I think a lot of the time it's very easy to say, oh, well, you for vaping, you for doing this, you for like acting out. And it's like, are youth really acting out? Or maybe we're not helping them enough. Maybe we're not really addressing what is the underlying issues, the underlying things that they are feeling. And instead we invalidate them. So I think in that way, it's really important to kind of dig deep, about these issues as well. But then more importantly, integrate this, I guess you could say, in our education systems in many ways. I wish we, for example, had this in our health and phys ed class. That's what I had when I was in high school.
Yeah, I think that is one of the biggest issues that are facing youth is not understanding the emotions that are flowing through them and not knowing how to express them properly, not knowing how to deal with those emotions. Because I had like a similar childhood where going through a bunch of different emotions and not understanding how to deal with them. So it's like you kind of have to teach yourself sometimes, but even that can go wrong because you don't really know how, but you're trying to figure out how. But yeah, especially in schools too, because there aren't many mental health resources in schools besides like the school therapists, and even those professionals are still like heavily burnt out. They don't have, or they're not getting paid enough regardless, so they're tending to quit a lot of the schools. There's not enough therapists in the schools regardless. So yeah, I would like to see that changed as well. I would like to see that focused on more, adding more like resources similar to kind of what you're doing and more mental health, kind of what Evolve Year is doing too. That's why we focused on schools, because the lack of resources in schools. So yeah, I think
Mhm.
that's a very important issue.
Yeah, I mean, I always think about it in the sense where I'm like, I think this is what's it called? I think this is like a metaphor as old as time, but it's one of
Yeah.
those things where it's like you want to give people the tools to add to their toolbox, you know? I look back and I just reflect on, I recall one time in grade 11, one of my teachers showed us meditation, but she didn't really talk about like why people meditate or how can meditation be helpful to somebody's life when they're going through a lot of difficulty. So I literally remember I was trying meditation at the time, but I was thinking, I was like, this is useless. Who would ever meditate? Cut back now 4 years later, and I do meditate because it's actually very, very helpful to me. And I can't help but think, I'm like, wow, I'm like, instead of doing those school assignments back then where you just just research like, oh, meditation whatever, and you just try it for 5 minutes. I think about it, I'm like, I really wish I had a better understanding. I was equipped with the understanding of why meditation can be such a valuable tool instead. So, I think about that a lot. I'm like, I really wish we, as you could mention, like put that into the actual school instead.
Yeah, like I think that one difference should definitely be more awareness programs and
Mm,
just base education on those different things. Just knowing the thing is one thing, and then knowing why that thing is useful or what it does is a different thing. Like you talk about
mm,
meditation. I think that's how most people come across meditation, is that they see it somewhere, they think it's cool, and they try it out, but don't really know what it does or like the purpose. So
yeah.
they try it, realize it doesn't work, or like say that it doesn't work, and then don't try it anymore.
Hmm.
When you understand why something works or how to do it, why is this important, it changes your perspective on that particular action, and you can actually do it differently. You actually learn more from it.
Exactly, exactly. Like I think about it all the time in the sense where I wish I was taught about like meditation and other like practices to help with like anxiety or depression in a way in which like I could have, instead of like 4 years later having to research different techniques myself, I wish I could have just like had that in the back of my brain already. And I could have just went, oh, hey, I remember like learning about meditation like back in grade 12, and I should totally use this skill right now, I think it's a shame that it doesn't work like that.
Yeah, yeah. Uh, we are coming towards the end of the conversation, so to
Mhm.
wrap this up, we're going to go ahead and ask this last hypothetical that we ask all of our guests. So, if you were in a room with 100 people and they were ready to listen to you and willing to act on whatever you said, what would you tell them?
Oh, intimidating. um, like anything? Okay. Let me think. Wow, this is such a deep question. Just I think reflecting right now on myself and what I've been going through as somebody who's in fourth year university, who's involved in a lot of extracurriculars, but still, feels sometimes a little bit lost. If I were to tell 100 people um, something to them, I guess you could say, is I would I would say that, you know, find a goal, have a goal that you want out of this life, have a goal that that is big. Dream as big as you want to be. But I also think, be happy with the journey that it takes to get there. I think that the reason why I say this is because over the past 4 years, I'm somebody which I want to see and do big changes within the city, within my own community, and even within my own family life sometimes. And I think it can feel very saddening and sometimes really upsetting when it feels as if, I'm not able to get there or I'm not getting there as fast as I thought I could. So instead, what I've really learned instead this year is to actually cherish the journey and to be happy with the journey and to instead just have confidence that you will get there one day, and instead just think about how nice it is, that every single day before you go to sleep, as long as you can tell yourself, hey, I'm pretty happy with what I did today, and I do think that I have taken a step in the right direction, then, you know, that's all right. It's okay. You're going to be fine. So I think in that way, that's kind of what I would pass on to everybody else.
Yeah, that's awesome. Back to that mindfulness concept, loving
Yeah.
the journey that you have.
Yeah, I was gonna say that it's becoming a lot bigger in my life right now because, as I said, right now, I'm going through a bit of a stressful period. So it's important to keep these things in the back of your mind.
Yeah, I've been appreciating the aspect of mindfulness too. Glad it's been working out for you.
Exactly.
So, is there anything specific that you want to shout out? Any social media, any organization?
I would say the only thing that I want to shout out is if you are somebody, a young person who's interested in civic engagement, who's really interested in hearing and doing something about issues within the city of Toronto, please, please, please check out the Toronto Youth Cabinet. We are always happy and open to having everybody here. And honestly, the most important part and the best thing about Toronto Youth Cabinet is that we get a lot of different perspectives from all walks of life. And honestly, that, that's very important for Toronto Youth Cabinet because we never want to operate with ignorance. So, if any of this today has interested in you, please, please, please apply. And also, you can just email me. My email is melanie@thetyc.ca. I'm happy to respond to anything.
All right. It was great meeting you today, Melanie. Amazing conversation, very enlightening.
Oh, and thank you so much for having me.